Chairman of His Royal Highness Emir Bargungu, the ED of NPHCDA, my dear brother and spiritual leader, the Emir of Shonga, and all of you, ladies and gentlemen, all protocols respected. But also a special word about the media, to thank you for coming today on this very positive morning, where there will be a clear message that I hope you will positively take away with you. The importance of the Northern Traditional Leaders Committee on Health in Nigeria can never be underestimated. I remember the days with the Emir of Shonga way back nearly 20 years ago, working together on the issue of polio. Without the Northern Traditional Leaders Conference engagement in polio, today Nigeria, and therefore Africa, would not be wild polio free. Now I want to take this opportunity to congratulate you all on that effort. It put Nigeria at the center of the global fight against polio, and Nigeria succeeded today in ensuring that Africa is wild polio free. That is a unique opportunity to show off what Nigeria can do and how the Northern Traditional Leaders Conference can spearhead the health of its nation. So thank you and congratulations. But in the same way, as we were addressing polio 20 years ago, today we have two priorities. One is continuing routine immunization to save those nearly 2,000 children a day who die as a result of not being immunized. The COVID-19 vaccine. I want to pause there and congratulate the NPHCDA, the Presidential Task Force, and His Excellency the President of Nigeria for their foresight in putting COVID-19 at the center of all government policy. This has enabled Nigeria, the government, its traditional leaders and religious leaders to address the issues of COVID systematically and across the board in all social contexts. On the 2nd of March, Nigeria received 3.924 million doses of COVAX vaccine. By the last thing on Friday, all but 80,000 of that vaccine had been utilized. Nearly 4 million, or about 4 million vaccine has been administered in Nigeria from March the 5th, when the flag-off took place, until today. That is a phenomenal achievement, and everyone, and especially NPHCDA, should be congratulated. Nigeria is trailing the way in Africa. It's trailing the way for most COVAX countries in its utilization of COVID-19 vaccines. So congratulations to all of Nigeria who have used it. What are the risks? For me, the risks are minimal. They're non-existent when you compare it to the risks of what would happen if we were not to take the vaccine. I myself have taken the vaccine. I have driven my own mother-in-law, 83-year-old mother-in-law, to administer her vaccine. I have driven my daughter, 20-year-old, to administer her vaccine. It is crucial that we understand the importance of our responsibility as community members to take that vaccine. The vaccine is both safe and effective. Nigeria has put in place a robust mechanism of monitoring any adverse effect against the vaccine. No deaths have been reported to date following the administration, and again I repeat, of 4 million doses of vaccine. No deaths have been reported in Nigeria. There have been a total of 14,000 adverse events, of which most have been minor, where paracetamol or other minor medication helps. The risk of thrombosis is extremely low, 1 in a million. Your risk of being hit by lightning is 1 in 500,000. How many of us have been hit by lightning? And therefore, how many of us will therefore have a risk of thrombosis? The vaccine prevents against severe diseases. It stops you from having to go into hospital and the dreaded use of oxygen and ventilators, as well as death due to COVID-19. I look forward to our discussions on this, and I will make a plea to all of you in our discussions to look upon this favourably, to ensure that we play our role in our communities to help people understand the benefits of COVID-19 vaccine, which, yes, we have to understand the risks as well, but the benefits far outweigh those risks. What the situation is now, and I'm sure my colleague from NPHCDA will elaborate more, is there will be a pause once we've fully utilised the 44 million doses of vaccine that are there. That will be completed this week. The next shipment of vaccine might not be until sometime at the end of August, the beginning of September. We have an opportunity now, not only on the success of routine immunization, and also position Nigeria in a place where if we could use COVID-19 vaccine, routine immunization, to the greater benefit of all the population in Nigeria, we would have started much earlier than anybody else. Conference to look at this issue of COVID-19 vaccine, to adopt and collectively, and I will give you all the support that you require from UNICEF, and in actual fact there are 4 of us in this room to be able to support you alongside our partners, the NPHCDA, to really move over the next 2 months to mobilize our communities to better understand the importance of vaccine for COVID and the low risks that are associated with it. The micro-planning at state level that ensures an integrated program of vaccination, so routine immunization and COVID-19 immunization, while addressing 2 different populations, can side by side ensure the effectiveness of our primary healthcare system. I want to finish off with a quote from the Holy Quran. When one saves a life, he actually saves the whole of humanity. In this case, if we don't save ourselves, we will not be able to save the world. By saving ourselves, not only are we helping us as Nigerians and Nigeria to work well, but it means it will protect and contribute to the global pandemic and the fight against that pandemic. If we do not address the pandemic here in Nigeria, different variants will come in and evolve in Nigeria. And not only will that have the detriment in Nigeria, but also elsewhere in the world. Nigeria, and particularly you as the Northern Traditional Leaders Conference, led the way 20 years ago on polio, and you succeeded. I strongly believe that today, in your deliberations, you can lead the way again on COVID-19 vaccines, and we will succeed together. Thank you very much.
Thank you, Mr. Hawkins. And I invite the ED to the vice please.
أعوذ بالله السميع العليم من الشيطان الرجيم بسم الله الرحمن الرحيم. Your Eminence, ably represented by the Chair NTLC, Royal Highnesses, esteemed members of the NTLC, Your Excellency, the representative of UNICEF, other representative of our partners, CDPP, directors of NPHCDA, I am delighted and honored to represent Dr. Faisal Shuaib, who would have been here himself. But for another urgency, he asked me to step in and read his address. So riding on the existing protocol, I read the address of Dr. Faisal. I'm greatly honored to address this very important meeting of our very respected royal fathers, custodians of our rich culture and tradition. Your Eminence, Your Royal Highnesses, I must confess that I always look forward to NTLC meetings as it gives me confidence that in our programs we are aligned with the people. This year has been a very challenging one due to the COVID-19 pandemic, which has affected all areas of our life, including immunization program. Nigeria, as we are all aware, has been certified WPV-free by Africa Regional Commission for the certification of poliomyelitis eradication. There are cases of circulating vaccine-derived polioviruses type 2 in some states. Hence, the need for us as a country to jealously guard our WPV-free status and stop the transmission of CVD-PVs in our communities. Your Highnesses, as today we have CVD-PV2 outbreaks in Abia, Bayelsa, Borno, Delta, FCT, Jigawa, Kano, Kebbi, Lagos, Niger, Rivers, Sokoto, Yobe, and Zamfara states. And we have conducted 4 outbreak responses using the novel oral polio vaccine, which is preferred as a choice as it doesn't seed the virus. However, some optimal performance has been recorded in all the states due to high numbers of missed children during the outbreak responses. This poor quality will affect how we are able to bring this outbreak under control. Your Highnesses, it is pertinent to state that donor funding for polio has drastically reduced. We will therefore be relying on your influence in advocating to political leaders on the need to continue to fund polio outbreak response campaigns. I also wish to humbly request for your continued support in mobilizing our people for the OBR campaigns and other subsequent rounds of the polio vaccination. Your Highnesses, I deeply appreciate your efforts in curbing the spread of COVID-19 in Nigeria, especially at the community level. During the vaccination rollout, advocacy visits were made to some areas. Sensitization meetings were also held to empower the traditional leaders and with the right information about the vaccines. Your Highnesses, your demonstration of leadership by example by being vaccinated publicly has contributed in no small measure to our successful phase 1 COVID-19 vaccination rollout, which is formally closing today. Your Highnesses, there have been reports of cases of vaccine hesitancy across the states, and one of the community engagement strategies was initiated to mitigate this challenge is the conduct of town hall meetings to address concerns of the general public and increase the uptake of COVID-19 vaccines. This is to improve community knowledge of the facts and benefits of COVID-19 vaccination and to enhance community ownership and participation in the COVID-19 vaccination campaign. The town hall meetings are to be conducted at 4 levels: zonal, state, LGA, and ward level. Already the zonal town hall meetings have been conducted successfully in North Central Zone in Nasarawa State, in the Northeast Zone in Adamawa State. The Northwest Zonal meeting was earlier scheduled for 1st of July, but was actually postponed due to the preparation for the coronation of the Emir of Kano. We will therefore be counting on your usual support in states to ensure they cascade the town hall meetings to the subnational level. I am optimistic that your concerted support in promoting COVID-19 vaccination in and outside your domain, Nigeria will rapidly achieve the required herd immunity so that we can return back to our normal lives. We once again solicit your continued support for primary health care generally, with special focus on routine immunization, maternal and child health interventions. On our part, we will continue to evolve strategies to improve and strengthen primary health care for the benefit of all Nigerians. Your Highnesses, I look forward to benefiting once again from your wealth of wisdom as you deliberate on issues that will strengthen our primary health care system in this country. I thank you so much for your attention.
Thank you, Dr. Domo. And this concludes the opening ceremony of this meeting. The press, if you please excuse us now.